The primary focus of the Skin Cancer Treatment Center is going to be the diagnosis and excision of skin cancers. But let's say you have a lesion, you don't know if it's cancer or not. You come in and we don't know if it's cancer or not. Our role is not going to be to guess what your lesion is, since a lot of times the guesser is wrong. So we're going to take a piece of it. We'll send it to the pathologist, the dermatopathologist, who will look at it under a microscope. They'll be able to tell us, usually within 5 days, what it is. And then we can schedule a time to excise it in an appropriate manner. Well, plastic surgeons we're surgery trained. We're surgeons first. And we're already taking care of the most difficult skin cancers. If a dermatologist needs help with something, they call a plastic surgeon. As a matter of fact, I used to go to Florida to do some of the more difficult plastic surgery and reconstructive procedures that the dermatologists weren't trained to do. Mm-hmm. So if we can do the hardest ones, why not do the easiest ones as well? One of the things that I noticed, particularly in my travels in Florida, where skin cancer is very prevalent, since they have two things, a lot of sun and a lot of elderly patients, is that the dermatologists, when they excise something, they basically take a pitching wedge and take a divot out of your skin, leaving a hole that has destroyed the architecture of the lesion. And the only true purpose of doing it this way is for speed. Not necessarily the best thing for the patient, is for the best thing for the dermatology treatment center. Well, we're not going to do that. We're going to excise it surgically with the clean margins and plastic surgery closures with minimal scars. There'll be no holes left on you. We're not going to burn things. We're not going to laser things. We're not going to freeze things. We're going to excise it surgically, give you the very best scar we possibly can, and the lesion will be completely excised. I think this what separates. Our goal is to change the way skin cancer is treated in the state of Arkansas. My primary focus before I'm through with my practice is if I can put an end to shave biopsies, then I'm going to. It doesn't help the patient. It destroys the architecture of the lesion. So let's say if you take that divot out and there's still some skin cancer left. Well, now you've destroyed the architecture. You don't know where the lesion stops. You don't know where it starts. All you see is a hole or a healed scar. And now you have to excise a bigger area than you would have had you just excised the thing in the first place. To me, I see no advantage to doing a shave biopsy. In a pigmented lesion, which say maybe is melanoma, if you shave it, you destroy the architecture. Well, we diagnose and treat melanomas based on the depth of the lesion. And if you've destroyed the ability to see the depth of that lesion, now you don't know as accurately, do we need to sample lymph nodes, for instance, with regards to the melanoma. So again, I think shave biopsies were designed for the benefit of the practitioner doing things as fast as possible, and does not take the patient care into consideration. And we're changing that. And we're going to hopefully, just by people deciding that this is a much better method, they're going to come and everybody will eventually be doing this same treatment, which I think is the best state-of-the-art way of dealing with skin cancer. I've helped take care of skin cancers for 30 years. When I moved my dad up into a local retirement facility, I noticed a couple of places on his legs, and I thought, well, we need to get those seen. So I called around to dermatologists, even some of which were my friends. And the shortest amount of time it was going to take for me to be able to get him to be seen was 3 months. And I felt like this was completely unacceptable. And so and the longest time was 6 months or more. So I said, fine. If the need for skin cancer treatment is in that much demand, then let's do it, and let's do it right, and let's see you quickly. Let's take care of you quickly. Let's give you a better scar with a better outcome, and do it in a much more timely manner. That is a great question. And that's why I'm trying to take the guesswork out of this equation. You have something and you want it checked out, you come see us. We'll biopsy it. We'll take a tiny piece of it, which will leave an insignificant scar inside the lesion. And we'll send it to the pathologist. He'll tell us exactly what it is. And we can base the treatment protocols on what you have. And if it's a benign mole, then you say, well, it's really not worth the additional scar to have it taken off. Or if we think that the scar is going to be better than the mole and you want to have it removed, then we're happy to do that. We're taking the guesswork out of the treatment of skin cancers. If you want something removed, come see us. We'll take it off. You don't have to see your primary care doctor first. You don't have to see a dermatologist first. You can pick up the phone and give us a call, and we'll test it for you. If you do see somebody else and they say, well, we can freeze this, we can scrape this, we can shave this, we can laser this, and you don't want that scar, then just tell them, thank you. No, may I please have a copy of my biopsy report, and come and call us, and we will excise this with the best plastics closure that can be done and give you the most scar-free result that's possible.